All right, listen, it's time for our elder care segment here. It's almost 10 o'clock. You're going to go out to the grocery store and you're going to shove your arm into a blood pressure pump just to make sure the numbers are okay. And just because they don't read triple digits, nothing to worry about, right? Wrong, says our good Hopkins Dr. Alicia Arbaje, who finished, by the way, runner-up in the Nobel. Thank you.
I'll have to try again next year.
Just that far. Your essay
wasn't quite right. I had some typos.
No. All right, we're going to talk about low blood pressure. We often forget, high, low.
Right. High is very important. We don't want to forget that it's important to treat high blood pressure, but because so many people have high blood pressure, they're on medications to lower their blood pressure, and low blood pressure in certain populations can be a problem as well for older adults.
What are the symptoms of low blood pressure?
So a couple things to remember about low blood pressure. It's when it happens and what happens. So when it happens, it's when you're getting up. So getting up from a meal, getting up from sitting down or laying down, getting up from after going to the bathroom. And when you're getting up, if you feel dizziness, lightheadedness, maybe some nausea, or maybe feeling like you're going to pass out, those are some typical signs of low blood pressure.
All right, high blood pressure, we know you're going to have a stroke, you have heart disease.
Right.
Low blood pressure, what do you have?
So you pass out, you fall, you break a bone, and over time, constant low blood pressure in older adults can lead to problems with your thinking and your mental ability, so it can be a precursor to having some dementia.
Well, for low blood pressure, you feel like tired a lot.
Right.
But you think, hey, as long as it's not high, I don't have nothing to worry about.
Right, which is not true. And the people that we're really talking about, we're not talking about the 65-year-olds.
Sure.
We're talking about 75-year-olds and 85-year-olds and above. These are the people that are more sensitive to low blood pressure. And why is that? Because as you get older, you need a little bit of a higher blood pressure to get blood up to your brain. So as you get older, you need that blood pressure to help your circulation to your brain. That's why it's important.
Out of 10 patients that come into your office, how many know what their blood pressure should be? The ballpark range.
That's a great question. Probably, I'm guessing about half. Why is that? Because it depends. The right blood pressure for you might be different than the right blood pressure for an 85-year-old person. So we know that normal is about 120 for the top number and 80 for the bottom number. And that's about right for most people. But depending on whether they have other medical conditions and on their age, their blood pressure may need to be a little bit higher.
Okay, when they come in and you tell them you have low high, you have low,
low high.
You have low high. You have low blood pressure. What do they think?
Oh, well, isn't that okay?
That's great. I'm in great shape.
Right. So again, the most important thing is that the person talk to their healthcare provider about what is the right blood pressure for them. And what I often recommend is that they keep a log of their blood pressure at home, because oftentimes the blood pressure in the doctor's office is different than the blood pressure at home. Sometimes people are nervous and they can be higher than usual. So it's important to check it at home.
And we just want to make sure, again, if you have low blood pressure, you still should be taking medicine too, right?
Right. It depends. You don't want to stop your medications necessarily or change them, but you want to talk to your healthcare provider about what's the right blood pressure for you exactly.
All right, doctor. Thank you. Next year for the Nobel.
All right.
I'll back
Keep your fingers crossed for me.
Megan will write a nice recommendation. It always works. Thank you very much.
Thank you.
All right, Megan.